Hi, Dr. Staci. We are very excited for this conversation today. Thank you so much for coming on our show. We've been wanting to have a holistic dentist on for quite some time, probably since we started this. And then I came across you through Marnie and I, one of our teachers, Dr. Stephen Cabral, a couple months ago, and we just knew we had to have you on to share your very important message, which is relevant not only for kids, but through adults. And I feel like this topic is one that's not talked about nearly enough, given that it's something that every human has, right? Teeth. And we all have to brush our teeth and floss our teeth. And we've been doing that since we were little, but there's a whole nother element when you think about functional dentistry and what that really means. So I know you're very busy with your practice and everything you have going on, which you're going to share today. So thank you so much for your time.
Oh, absolutely. I love talking about oral health and the oral systemic connection. So thank you for having me on.
Great. Well, before we dive in and kind of get into the main topic for today, we love asking our guests, what is one non-negotiable that you have to start each day?
Each day, well, I like to wake up and just acknowledge the fact that I woke up feeling healthy and vibrant, and just kind of take a moment of gratitude for my day and kind of set the balance and the tone for the day. But I have to make sure I hydrate. It's really important for me to get up and drink water. I usually add electrolytes to it. I've noticed since I've started doing that, I feel so much better. And if I don't do it, I really have an off day. So I really like to encourage our patients to do things that are just, small changes to your daily life that are easy and accessible. And I definitely think starting off your day hydrating, because we lose so many fluids and so much water as we sleep, that it's really good to start your day off that way.
Yes, we couldn't agree more. So what's your favorite brand of electrolytes? Just curious.
Yeah, I use Element quite a bit. I just do the plain. I don't like the flavorings. I've been using Mycosciences powder too, which is Mike Mutzel's brand that he does. I've been enjoying it because it has some extra creatine and things in it, because I do a morning workout too. So those are some of my favorites.
Nice.
Yeah. It's kind of amazing how many people don't drink enough water.
I know.
Like if it's not on your radar or you're not in the habit, when I talk to other people, they're like always shocked by how many fluids I take in on a daily basis.
Well, and the problem too, when you get dehydrated, it like down regulates. So you don't even realize you're dehydrated. So it creates a vicious cycle too. And then so many people they think copious amounts of water, but they're not really absorbing it efficiently, which is why I like to add some salt or some electrolyte. Just a pinch of Himalayan salt is wonderful too. But I do like to add electrolytes.
Nice.
I agree.
Well, we want to hear about how you became a functional medicine dentist and how you decided to work with kids specifically. And maybe if you can just tell us like the quick rundown on your background.
There's a long and short version, so I'll keep it short. But essentially, I practiced as a general dentist for many years. And I really was very dissatisfied with my career. I felt we mostly just dealt with end-stage disease, and we were just constantly putting Band-Aids on things. And what was really discouraging is I noticed patients just kept coming back with disease and illness and gum disease and new cavities, and nothing was really changing. The work I was doing was temporary, essentially. And so I felt at a loss, I wasn't really moving the needle. I didn't have a sense of purpose. So I thought, gosh, how do I get more upstream? How do I prevent these diseases from even happening? How do I really help patient overall global health? And I thought, well, that comes with education, and that's going to come from the parents, and that's going to come with children. I need to catch them way, way, way before they're dealing with root canals and periodontal disease and such. So I went back and got my board certification in pediatrics. I worked as an associate and still in very traditional practices, because that unfortunately is still how many practices are being run. And that's certainly how we're being educated. And it's important to be educated in a more conventional manner, but there's just nowhere to get additional functional dental and medicine training in one place yet. We're working on that. But so I decided to open my own office, and really I realized I wasn't being true with the way I practice. I wasn't implementing the way I lived my life with how I was practicing and educating my patients. And I always have tried to live a cleaner life, a more holistic life, if you will, at least since my late teen years. And obviously that's a journey. So I just kind of rebranded, and I started really digging deep and getting more CE and education and finding mentors in the space that were practicing differently, and really looking at more root cause approaches and understanding that it's beyond the tooth and it's beyond the mouth, and it's really how that oral health impacts our systemic health and the oral systemic connection. And we can even connect some of these dots in childhood. It's really important because the mouth isn't separate from the body. It's part of our body. It's the gateway into our body. And so I opened my office, and, it's been a journey and slow evolution, but I'm really proud of it. I've been there with my office for 8 years, and am now looking to kind of help educate other dentists in the space of how to practice similarly. My education was so piecemeal and convoluted, and not everyone will be along for that ride. So we are working on creating a more formal education system for functional dentists.
Which would be amazing. I mean, if you can be on the forefront of creating that program and developing it, and
it's in the works.
That's awesome.
It's in
much
the works,
needed.
Yeah. It's going to take a while, but yeah.
And I saw all your different, degrees and certifications that you had after dental school. And I think that you went to IIN.
I did. That's how I started.
Which is interesting. That's what Marnie and I started. That's our journey to
cool.
health coaching.
Yeah. I just, it was interesting. I was listening. I saw a lecture by Dr. Lowdog. She's affiliated with Andrew Weil.
Yeah. Mm-hmm.
And I went up to her after, and I said, she was applying these pretty high level nutritional principles to oral health, because that was her audience. And I hadn't heard any of these things before. And this was, again, it was maybe a decade ago. And I went up to her, I said, how do I learn this? And I said, I have a young child, a baby at home. I can't travel. What do you recommend? And she said, you should check out IIN. It's a really great place to kind of dip your toe in.
Yeah.
And it was truly that. And so that is where I started, and it just kind of exploded from there.
That's amazing. That's how we feel too about our journey through health coaching. Yeah. So let's back up a minute, because I know a lot of people are like, functional dentistry, holistic dentistry. What is that? I mean, I was introduced to it a number of years ago, and now I have a holistic dentist that I've seen for several years. But can you just explain to our listeners, what is that? How does it differ from traditional dentistry? And is there a difference between holistic dentistry and functional?
Yeah. It's nuanced. Holistic is a term that gets thrown around a lot. And unfortunately, it does have some negative connotations with it, I think, with certain sectors of the population, because it's vague, but essentially holistic means whole body, right? So we're looking beyond the tooth, we're looking beyond the mouth, we're thinking about how everything we do in that patient, how every material we use, how every product we suggest is affecting that patient beyond their mouth. But I would take it a step further with functional dentistry. And so functional dentistry is really incorporating the principles of functional medicine into the way you practice. And that has a lot to do with the oral microbiome and the oral gut axis and the oral brain axis, how these microbes in our body are leading to imbalances in disease downstream in other areas. And this can influence our immune health, our hormones, how are we breathing? How are our faces and jaws developing and growing? What is our gut health like? We talk about skin health. I mean, you're really looking at everything systemically. And I would say with more evidence-based medicine, but with a functional or root cause approach.
So no Botox at the dentist.
There are people doing that. I mean, for
Sorry, I just had to say it.
But people are using it for TMJ.
Yes,
so,
I've heard that.
Yeah, and I mean, if you're in chronic, I don't like purism or black and white. obviously Botox has concerns, but if you're in chronic oral facial pain and it's debilitating, and that's going to help get that patient just able to get out of bed every day, I mean, that's something to look into until we can explore really what the root cause is for that patient. But you are right. We're not doing it's not cosmetic dentistry at all. Yeah.
Like for another revenue stream for a dentist.
Correct. I mean, but this is the thing, because there's no standardization really, like for example, there's the Institute of Functional Medicine. There's Dr. Cabral's training. Those are ways to standardize training so that when you go to that provider, you feel pretty confident that they have a great education and you know what you're going to be getting. But right now, it's sort of like anyone can call themselves a holistic dentist. Anyone can call themselves a functional dentist because it can be great marketing. And if you're business savvy, you'll say, well, a lot of patients are looking for this, but it doesn't necessarily mean you're practicing that way truly. And so unfortunately, patients do need to be careful and do a little research and, ask around and read reviews and get second opinions, because we don't in functional dentistry have a standardized training location yet.
Okay. So that's good to know.
How does that work? Like, I've never been to a functional medicine dentist. So let's say I make an appointment. Are you taking a health history like a functional medicine doctor would?
Yes. It's extreme. Yes. It takes a long time. Yes.
Okay. And then are you running lab tests and stuff?
Yes.
And doing all of that like extra stuff on top? So you're not just going for a routine teeth cleaning.
In my opinion, if you're truly practicing functional dentistry, there should be a lot of that. But of course, it's bio-individual. So we wouldn't know until we did our intake and learn more about the patient. But my medical history is long. Patients often comment on it. However, usually they're pretty pumped because they just from the medical intake, they can tell, whoa, this place is different. We talk about their pregnancy, their birth history, toxin exposures. Have they been exposed to lead? Have they been exposed to, is there Lyme disease? Is there mold in the home? Eczema, food sensitivities. I mean, we really, really dig quite deep compared to your standard, what is your chief complaint? Does anything hurt in your mouth type of thing? We go really heavily into diet, nutrition, eating frequency, like all of the things. So that is how it starts. And then as for labs, again, I'm in peds, so it's different. We have to stay within our scope, of course, but things like oral microbiome testing, it's just like we do gut mapping. I don't know, how can I treat periodontal disease if I have no idea what pathogens I'm dealing with? Some of them need antibiotics, some of them need herbal medicaments, some of them interact with each other in a very unique way. So we need that baseline testing to understand what's going on in that patient. Vitamin D testing is extremely important. Vitamin D deficiency is absolutely linked to dental disease and cavity increase, especially in children. Well, for all patients, but for me, that's very applicable for kids. Vitamin D testing, and we have finger prick tests that are quite reliable that we will offer to families if they're interested. Some of them choose to take them home and do them on their own watch. Or if we have to do like a sedation, which does have to happen sometimes with kids, we'll do it while they're under sedation. And almost every time they're severely deficient in vitamin D. We work with a lot of functional medicine doctors and naturopaths to do micronutrient testing and certainly focusing on gut health too. Are there gene SNPs? Do they have MTHFR, COMT? How are they absorbing their nutrients? Wow. Is there gluten sensitivity? Because gluten intolerance is linked to cavities. Gluten intolerance is linked to periodontal disease in the future, kind of more autoimmune type thing. So it's really digging deep, and we're taught none of this in dental school, and quite frankly there's not space in the dental school program for this. But how I envision it working is then maybe you could go get a specialty in functional dentistry, and so it might be an extra 2-year curriculum or sort of like a general practice residency or something. And that's what I'm working on right now currently, including with some pretty well-known dental schools, so which is really, really exciting.
I mean, it's exciting. And honestly, as a dentist or someone who wants to explore that career, this seems way more interesting and exciting to me than just going in for a normal routine, because quite honestly, I never really loved the dentist. And now I really enjoy my dentist, and I can have a conversation with them and they get where I'm coming from, or before they would just kind of look at me and think I was like crazy for like.
I know.
So,
I know. And that's what happened to me. I mean, I honestly felt a bit depressed in my career because I just felt everything I did was just a drop of sand in this huge, vast, crater. I wasn't moving the needle at all. I had no sense of purpose. And dentistry gets really boring. I mean, there are dentists out there, I'm sure, that love what they do, but I'll tell you, most dentists are quite burned out. They don't really like their career. It's very Groundhog Day. It's the same thing over and over and over again. And so this does create excitement, and you really feel, wow, I'm connecting the dots for this patient and I'm really helping them get healthy. Because I will tell you, a filling isn't creating health. That is a very acute situation, and you're essentially putting a Band-Aid on it. But why do you have the cavity to begin with? Are you mineral deficient? Do you have gut dysbiosis? Do you have intestinal permeability? These we know can lead to other issues systemically, including mood disorders and Alzheimer's and depression, all these huge, huge things. And so if you can help educate and guide a patient toward that type of health, I mean, that it invigorates you. I mean, that we all are looking for a sense of purpose, right? And so
absolutely,
it's really wonderful.
Can I ask you a question about fillings specifically?
Yeah.
So like I have some fillings that I got as a child. I was probably like 6 or 7, and they're still in my mouth, and they're definitely like the silver, whatever ones. I can't remember what it's called, but
mercury, alloy mercury.
Yeah. And I was told as a child that I got those because I was eating too much sugar.
Yeah.
And I wasn't brushing my teeth well enough, and it was my fault. And if I brushed my teeth better, I wouldn't get cavities.
And if you use fluoride. Yeah.
Yes. Yeah. Well, fluoride was just, we'll dive into that in a minute. But so my question is, can you outgrow those cavities, or are those like not outgrow them, but do I still need those? Or like if I'm living a healthy life, could those potentially come out and my teeth would be fine? Does that make sense?
The fillings, could the fillings come out? Unfortunately, no, because they drilled into your tooth. Okay. And so if they came out, you would have this hole in your tooth that's going to trap food. Yeah, it's probably be very sensitive.
Sounds horrible.
However, cavities are not your destiny. And just because you have them in childhood, although the studies show once you have cavities in childhood, you are more likely to have them in adulthood.
Well, knock on wood, I've never had them since.
Yes. But things change in you. So your microbiome change, your diet change, your habit change. You're drinking more water, which makes your saliva optimal and healthy. Our saliva is this golden elixir, which protects our teeth. It has enzymes and immune cells and minerals in it that are actually protective and supporting the beneficial commensal bacteria as well. So we can change our health, of course, and sometimes it's a journey, but it's not just hygiene and diet. Diet, I would say is high up, but I think hygiene's pretty far down. And so we have seen an uptick in cavities in our species since the agricultural revolution, and then again from the industrialized revolution, where we started milling and processing, and flour and sugar got added to everything, and we don't chew our food like we used to, and things are now mineral and nutrient deficient. We've stripped our soil. But, 10,000 years ago, humans really didn't have cavities. Ancestral humans were not dealing with decay. Just like other animal species, other mammals on this planet, I mean, wolves don't get decay. What do to get decay are domesticated animals because they're eating kibble, right? So it's our diet, number one, that's impacting our microbiome, both our gut and our oral microbiome, which influence one another. We're breathing differently than we used to. So this is epigenetics, but because we don't chew like we used to chew 4 hours a day, foraging and, chewing on raw meat and bones. We now chew 4 minutes a day because we're slurping down Go-Gurts and smoothies and mac and cheese, and that act of chewing, form follows function. So all these muscles are chewing, you're expanding, you're growing the face starting in childhood. And so because of that, our airways are shrinking, we mouth breathe more, our face shape has changed. And because of that, when you mouth breathe more, that's influencing your oral microbiome and your gut microbiome and your immune health too. So there's just so many layers to it. But modern society has not been kind to oral facial development or dental development for sure.
I mean, this has all been really fascinating, and I've been on my own journey. So I went to see this holistic dentist. It's probably been 4 years ago. And she said, "Oh, you're tongue tied.
Yeah.
I have narrow air passageways." She wanted me to go to like basically speech therapy for this.
Mm-hmm.
I now have, Invisalign and braces, and I'm trying to figure out next steps. So and I realized I was mouth breathing and I was snoring, and people are like, "Why are you snoring? You're not like a big person or anything." Like, I've had all these issues that literally didn't get diagnosed until my mid 40s, and now I'm almost 50.
It's really common.
Yeah. So I guess we want to dive in. I don't know where we want to go here. We want to talk about mouth breathing. We want to talk about fluoride and all these things, but let's talk a little bit maybe about mouth breathing, because I feel like it's been really with the mouth tape, like it's
a silent epidemic. Absolutely. Yeah.
And if anyone's read the book Breathe, they know, they're like, oh my gosh, you could
it's such
if we just started breathing through our nose, we could add years to our lives.
That book is incredible. James is amazing. He's absolutely amazing. He made it cool. He made airway really sexy, which is good. We
and mouth tape, right?
Yeah, I mouth tape every night. So, okay. So mouth breathing begets mouth breathing. And so, so we're not chewing like we used to. So our faces have changed. Ancestrally, our faces are getting long and narrow. We're getting hunched over. Think of Napoleon Dynamite. That's a great character to think of, the typical mouth breather. This is not great. It's not great for your posture. It's not great craniosacrally. It's not great energetically. But when we breathe through our mouth, we're getting less oxygen. If we're not breathing through our nose, we tend to have low nitric oxide molecules in concentration in our body. That could be a whole other podcast about nitric oxide, but that can affect cardiovascular health. When we breathe through our mouths get dried out. So we don't have all that benefit of our healthy protective saliva. The pH lowers, so it becomes acidic, and that's where pathogenic bacteria thrive, and they can just take off, and they can cause mineral, they release acid after we eat fermentable carbohydrates, and think ultra-processed foods there. And then it can really shift the microbiome and cause a lot of issues, including now we swallow 2,000 times a day. So we're swallowing that pathogenic bacteria. What is that doing downstream to our gut and intestinal health? So it can affect a lot. And so mouth breathing also, it can affect how we sleep. So we're not getting into deep restorative sleep. And the thing is, so many women have sleep disordered breathing, just like you. And we associate airway issues as obstructive sleep apnea with, larger people with redundant tissues. That is not true. Sleep and airway issues are on a continuum, and there's, dysregulated breathing, there's sleep disordered breathing, and sleep apnea is way down here, right? So you could be anywhere on the spectrum, and a lot of women have sleep disordered breathing. And so if you wear any sort of wearable, like an Oura ring or, a tracker, and you're looking at your sleep, you often may notice you don't get into deep restorative sleep. You're not getting into your REM cycles, and you're not getting into that lymphatic cleansing, cleansing toxins from the brain. You're waking up a lot, so your oxygen saturations are down. You're not getting rested restorative sleep, and you feel like garbage. This affects your hormones, your cortisol levels. And then once you can start breathing through your nose, a lot improves. So we're walking around as a society of mouth breathers. And, a lot of people say, what's the most important thing for health? And everyone has an opinion. Is it diet? Is it hydration? James Nestor, and I agree with him, we'd argue it's sleep and how you breathe. It's absolutely foundational. I mean, you can eat well, exercise, all of these things, but if you're not optimizing your sleep and breathing, I think you're not going to be feeling great. And so where mouth taping comes in is it's a lot to unpack this. Again, this could be a weekend-long lecture or more, but it can be a lot. There's myofunctional therapy, which is probably who you started seeing, like speech and myofunctional therapy. There's structural issues. So actually, how are your jaws and your face and your skull shaped? we can manipulate that. Now, it used to be in adults, it had to be surgery, but now we have cooler appliances and things that we can do to help just expand. I mean, it's volumetric. So if you make the face wider, the jaws wider, the airway bigger, the sinuses wider, I can breathe through my nose better. You know, we're bombarded with so many allergens and asthma and all of these things from toxins and things in our environment too. So that can be impacting it. But so it can be structural or orthodontic. It can be soft tissue. Do you have adenoid enlargement, enlarged turbinates? Do you have tonsil issues? There's just a lot that can go into it. So it's kind of complicated. So where mouth taping comes in, it's literally a Band-Aid until we can figure out the root cause. But sometimes the solution, it's too much for people. It's too expensive. People don't want jaw surgery. They just want to be optimized. And so that's what happened to me, is that I have just low muscle tone. I suffered a really bad bicycle accident. I was 10. And so my alignment and everything's off. And so I mouth tape, because I'm just physically keeping my mouth closed so it doesn't pop open. So I'm making myself breathe through my nose all night. And since I've done that, my sleep scores are 98s every night. If I forget my mouth tape, if I'm traveling or something, it is a disaster. And I feel like garbage the next day. And so the rules with mouth taping is you just want to make sure that you can breathe through your nose calmly without feeling panicked or like fight or flight for 3 minutes. So literally close your lips, time yourself. If you can, that means you can breathe through your nose, and you could start playing around with mouth taping. It makes a lot of people uncomfortable, but I think it is becoming more normalized as just sleep hygiene. It's part of sleep hygiene now. And your partner might think it's weird, as my husband did 5 years ago, and now he mouth tapes every night. So it's wonderful. Yeah.
Well, I've had my husband do it because he's a snorer. And I know my youngest son, who was tongue-tied at birth and had the surgery, which I didn't have when I was younger. Mm-hmm. I know he's got some issues. Like, I just have been learning more in this course I'm taking. And so I've started to have him mouth tape. I mean, he's 13, so he's not actually that young.
No,
and it was fine. He was like fine with it. I mean,
totally.
Sometimes it falls off a little bit in the middle of the night, but.
Do you know what's interesting? There's Life magazine ads from the 30s and 40s of like these rubber bands that people would wear around their chins. Okay. It's the same thing. Yeah. So in many cultures, and actually we do know our ancestral mamas closing their babies' mouths. It's myofunctional therapy. They're training the muscles to be closed. But, you know, if you're tongue-tied, I'll try to visualize this and explain it. So in utero, your tongue ideally starts to push up to the palate. That's where it should live. Your tongue is this extremely strong muscle. And as it lives up at the palate, it starts to spread and lateralize the face and the sinuses and create this big, wide jaw. If you're tied, your tongue can't get up there. It can't even lift. So your bone never develops. It never gets pushed out. So you have a high, vaulted, narrow palate. Yeah. The palate, this bone, is the roof of the mouth. The roof of the mouth is the floor of the nose. It's the same bone. If it's narrow, your sinuses are narrow. We have a septum right here. If your palate's narrow, what happens to the septum? It bows, it tilts. That's a deviated septum. Once you expand the palate, picture this, whoop, it straightens up. Everything straightens. Volumetric, it gets larger and wider. So that's why missed tongue ties, it really can affect facial development in children. And so the earlier we can detect it and address it, if it's causing functional issues, there can be better outcomes for facial development. And then, of course, breastfeeding is a really wonderful way to grow the face. And many women can't, or it's just not a choice they want to pursue, or they can't do it as long as they want. But if you can breastfeed for as long as you're comfortable with, that is one of the best ways to develop your child's airway.
That's so interesting. I want to go back to the mouth tape for 1 second. I'm really curious if, as a pediatric dentist, you are recommending that parents encourage their children to mouth tape. I'm just thinking about
It's a great question.
My 3 kids, and they would think I was nuts if I suggested that they mouth tape.
But you can explain it to them. You say, listen, humans are supposed to be breathing through our noses. We're obligate nasal breathers. Your nose filters the air. There's immune cells in there. There's really important molecules that are released, nitric oxide. It warms the air. It humidifies the air. We are supposed to be breathing through our noses. So this is just a way to remind you to do that. And the interesting thing is, over time, you're building up the strength. So when you close your mouth, it forces your tongue up. Your tongue's a muscle. And so eventually the tone will improve. Just like if you go to the gym, this is where myofunctional therapy comes in, is that it can help strengthen these muscles more. But Dr. Sharush Zaghi, who's out of the Breathe Institute, he's done a lot of research in this. He's an otolaryngologist, or an ENT. And so he has found around the age of 3 and above, you could start lip taping, sleep taping, mouth taping. However, I don't suggest parents just do it. I would like your child screened by an airway focused dentist or an ENT, because with a lot of kids, they have an adenoid enlargement, tonsillar enlargement. I mean, we want to just make sure that they have a patent airway, that they really can breathe through their nose. Obviously, you would never do it when they're sick or they have a cold. If I have a cold, I'm not mouth taping and I feel like total garbage the next day. But I just can't, So if you have diagnosed obstructive sleep apnea, I wouldn't suggest it unless you've been cleared. And there are more docs, sleep medicine docs, who are prescribing CPAPs and also mouth taping underneath it, because sometimes with the CPAP, your mouth still pops open and they get dental decay and like root caries and things. And so we're just taping under the CPAP. So the oxygen's being forced through the nose. So, you have to do what's right for you. As my daughter had a missed tongue tie, she's 10 now. We diagnosed it around 3. This is partly why I started exploring this additional education and training. And she went through all the expansion and myofunctional therapy and everything. But as we were sorting that out, I would mouth tape her. And I did it with her acknowledgement. I've seen videos of moms going in while their kids are sleeping and taping them. I don't like that.
Well, I have teenagers and young adult children, so that wouldn't work so well.
You just say, hey, you could make it. I always like gamifying things with kids and teens to be like, hey, let's do this experiment. Let's do this for 1 week. And I want you just to see how you feel. Do you feel better in the morning when you wake up? And I promise you they will. There's no way they won't.
Do you think you notice it after one night?
Yes.
Do you, Stephanie? Because I know you do it as well.
No, I haven't noticed it. Like my sleep score, I wear an Oura ring too. So my oxygen saturation is always 98, 99.
But not what your machines are telling you, just like how you feel.
I have felt better. I stopped. I was doing it and I thought, oh, well, now I've trained myself. But now it sounds like you're always wearing them. The mouth tape. So I stopped for a long time.
I'll wear mouth tape probably till I pass on from this beautiful planet.
So I should really buy a bulk up when I order it on Amazon next time.
I just, I do know my tongue strength is better, but I still notice if I don't do it, my mouth, and here's a way to tell, are your lips dry in the morning, or do you have dry mouth or nasty mouth, bad breath?
No,
your mouth.
I don't. I'm not as dehydrated as I used to be sometimes. And I notice my tongue is for sure stronger. So when I've been really focused on keeping my tongue at the roof of my mouth, and it's easy enough for me to do. So I do believe that it's helping.
So maybe you're nasal breathing all night and you don't need to tape anymore. I just still do. And this is why we're all different. We're just all different.
Someone told me though, when someone in my family did say that, oh, you were snoring. And I was like, what? I thought I was breathing through my nose. So then I started using it again, a couple weeks ago.
Yeah.
And what's your favorite brand?
Yeah, good question. Again, this is personal preference. So some people just use 3M, the medical tape, and they'll just put it like this. That doesn't work well for me.
Yeah. Me either.
I really like Somnifix is one that I really like. It has a little slit in the middle too. So that's the other thing. You can still breathe through your mouth with these tapes. They either have pores in them you can breathe through, or there's little slits. So I like Somnifix, but my new favorite, and I don't love the branding, but grain of salt, is called hostage tape.
Oh
Um,
God.
I think they were marketing to like the Joe Rogan crowd. They were trying to get more men on board. But I will tell you, it's made from like a fabric, almost like kinesiology tape. So it's really flexible, and so you can breathe it, but it's porous, so you can breathe through it. But oh man, it really works well. It really works well. My husband likes that. It's really great for facial hair. Not
Oh,
that I have that, but it's just a little bit stronger for me. But those are a couple of my favorites.
okay.
Okay.
Oh, and then sorry, there's Myo tape, MYO tape, and that's a great one for kids because it's just like a square and it's all open in the middle. So it's kind of like a girdle. I don't like that for me. It doesn't work for me, but for kids, it can be wonderful because then their lips are completely exposed and open. It just goes around the lips. And
So how
kinda
does
like,
it help them? It just helps the lips be shut.
yeah, like it's also made of that kind of stretchy kinesiology fabric. So it's like a girdle. It just kind of like cinches, but from the outside.
Okay.
And it's very gentle. You can check it out, and they have like fun colors and stuff.
Okay. Well, anyway, you're right. We could spend a whole hour talking about that, but we'd love to dive in and talk a little bit about the somewhat controversial topic of fluoride.
Yeah.
And maybe starting by just talking about some of the myths that maybe you can debunk.
Mm-hmm.
With like fluoride treatment and fluoride toothpaste. I mean, I've been declining fluoride treatment for my kids for years, and I always get a funny look from my dentist.
Yeah, I feel like I'm doing something wrong when I'm
Yeah.
at the dentist and I say no fluoride.
No fluoride.
I literally feel like they're looking at me like I'm from another planet and I'm doing a disservice.
They probably are, and that is something that they need to come to terms with. That's on them, not you. So we're really, really taught to not question fluoride in dental school. I mean, it is inundated in us, and including myself. And I used to be a super, you get fluoride, you get fluoride, you get fluoride. I didn't even think about it. But we are not fluoride deficient. No one needs fluoride in their teeth. Our ancestors didn't have all these fluoride products, and they didn't have cavities. That is not the root cause of your cavities. Lack of fluoride is not the root cause of your cavities. Your dental disease is from how you're breathing, your oral microbiome, what you're eating. Are you eating ultra processed foods? How frequently are you eating them? Because eating duration and frequency matter, because every time we eat, our mouth becomes acidic. So just like we need to let our guts rest, we're learning about that. We need to let our mouths rest too. And so we like to eat more on a schedule every 2 hours. Are you dehydrated? Are you mineral deficient? Are you vitamin deficient? All of these things. So fluoride also isn't the panacea we thought it was. Everyone keeps touting this false information that it's the best public health measure, blah, 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 and that it reduces cavity risk and it's saving the cavity crisis. Cavities are still the #1 chronic disease globally in the world, even since fluoride has been introduced.
Wow.
I see plenty of patients who use fluoride toothpaste, fluoride rinses, fluoride supplements, fluoridated water. They still get decay. And it's because fluoride cannot compete with the modern diet and how we're breathing and a microbiome dysbiosis. So it's a Band-Aid. So fluoride can make your teeth more acid resistant, but it's also, its critical pH is very acidic. So these products that we're using have a low pH. So what are these toothpastes doing to your oral microbiome? I would argue they're not helping. Fluoride is antimicrobial. It's not selective, so it can be damaging your microbiome. But on top of all of this, fluoride is classified as a neurotoxin. So specifically, we need to separate, systemic fluoride, which really is water fluoridation or prescription fluoride, and then topical fluoride, okay? So there is a lot of data right now to show major concerns with systemic fluoride, including water fluoridation. There's a federal lawsuit right now out of San Francisco. It's essentially the people versus the EPA. It's been going on since 2020. The judge is supposed to rule in March, where he has said, okay, dental community, you love fluoride. I get it. You think it's great for teeth. I don't care about teeth. I want to know what this is doing to the rest of these patients. How is it affecting brain development? How is it affecting their thyroids? How is it affecting iodine levels? How is it affecting bone health? Because it's extremely electronegative and very reactive in the body. And so there's a lot of studies right now showing that increased amounts of systemic fluoride can impact child's brain development, specifically IQ, and as well as all the endocrinology issues that it can have too. So we will see. He's had expert witnesses like, endocrinologists, neuroscientists, biochemists, but he doesn't want to talk to dentists. And I've been following it very closely. I'm reading all the transcripts. It doesn't look good for water fluoridation. The Department of Health and Human Services had a national toxicology report that was just released under the Freedom of Information Act because it was being held under lock and key for, I think, 6 years. Their conclusion after all of their studies on the safety of water fluoridation, which, by the way, it was added to our water without any safety studies because this was in the 40s before evidence-based medicine. And it was also added based on observational studies, not systemic reviews or anything that we would approve of now. So the National Toxicology Report, which came out earlier this year, it was released because the judge forced it to be released, said their conclusion was that there's no, at this time, based on the current safety data, there's no safe level of fluoride in our water. The American Dental Association and all these pro-fluoride groups went bonkers and they tried to rip apart everything they did. And then magically 2 weeks later, the NTP, National Toxicology Program, came out and said, well, we need more research. Okay, so take that as you will. But the judge has this in his possession, and he's getting pretty grumpy. So we'll see how he rules. I'm hopeful that it will be removed because it's, regardless of how you feel about the neurotoxicity, you can't titrate it easily. You can't really dose it. You might drink a liter of water a day from a fluoridated, out of your faucet, and I might drink 2 gallons of water a day. And then we have to think about the weight of the patient, the bioavailability. We're mass medicating patients without their consent and without titrating their need. I mean, wow. It's kind of outrageous. We're one of the last countries to still fluoridate our water. Many countries have taken it out. I think 97% of the world is unfluoridated at this point, because a lot of the reasons are the medical ethics of it. So we'll see. So that's systemic fluoride. So I do recommend to filter your water with a high quality water filter. The other thing is too, the guidelines for the AAP, American Academy of Pediatrics, and the AAPD, the American Academy of Pediatric Dentistry, they still recommend fluoride supplements in areas that aren't fluoridated. But what's interesting is we know, and they even teach us in dental school, that fluoride works topically, not systemically. So why are we ingesting it? Especially when there's these potentials for neurotoxicity and other systemic issues. So part of that is likely because medical guidelines take so long to update. There's studies to show it can take 17 years for medical guidelines to update. So I don't know. I personally would not ingest fluoride at all. Now let's talk topical. So I still have the same concerns. If you look under electron microscopy of what fluoride does to enamel, it actually arguably can make enamel weaker in a lot of ways. So it's just very controversial. But that being said, we know your children, especially, they're swallowing it. It's being absorbed through the oral mucosa. Think about nitroglycerin and things we take, or homeopathy. We take medicines under our tongue. Things are absorbed through our oral mucosa. And so it's sort of that rain barrel effect, as Dr. Cabral speaks of. What is the cumulative effect of this fluoride exposure? Something we use twice a day in our toothpaste. Plus now dentists are saying, oh, you need this rinse. Now take this prescription. Let me put this fluoride varnish on you. It's in processed foods. So if you're drinking a beverage or eating some soup that's made in a facility where the community fluoridates their water, they're not filtering that fluoride out. So you're getting it in processed foods. We can't calculate the dose for these patients. And then of course there's genetic SNPs and genetic susceptibility in patients that are more vulnerable to some of these anions. What's your underlying immune status? Some people might be fine being exposed to a ton of fluoride, and some people might be really sensitive to it. And so I can't look a parent in the eye and say, I think it's totally safe for your child, especially now that I know there's something comparable, and that's hydroxyapatite. And that's a biomimetic mineral, essentially. It's what our enamel is already composed of. It's 97% hydroxyapatite. Our bone is 60% hydroxyapatite. And so this is more biomimetic, and it's calcium and phosphorus, essentially. And the SCCS in Europe has done some about 8 years of research and studies to ensure hydroxyapatite is safe. It's almost like the FDA, which of course the FDA hasn't done anything here for it, but the SCCS in Europe has approved hydroxyapatite to be used in oral healthcare products. I see incredible clinical benefits from patients using it. That's what my family uses. Safe to swallow, no poison control label. And so
where do you get it?
You can get it now in stores. There are some brands coming out. There's Boca and Risewell, but I found a lot of these products also still are either acidic or they have emulsifiers or surfactants in them. And so are really excessive essential oils. So it's all about the microbiome, right? We want to not carpet bomb the microbiome, and essential oils, for example, are antimicrobial. So interestingly, I've worked with a colleague I met on Instagram, Dr. Mark Berhenna, and he has the platform Ask the Dentist. Many people know him. He's a really top leading functional dentist. And he and I become friends. And then we just kept complaining about how there were no perfect toothpaste. There were some pretty good ones, but nothing perfect. And so we decided to create our own. And so we have our own toothpaste out now. And while we do use hydroxyapatite, our big angle is oral microbiome supportive. And so we have prebiotics and amino acids in it that have been shown through the research to support commensal bacteria and reduce plaque accumulation in the mouth. So it's really more than a toothpaste. It will mineralize teeth, but it also is like a supplement for your mouth.
That's so interesting. Awesome. So I currently use Native, if you know that brand. Mm-hmm. With no fluoride in it.
Yeah, I'd have to look at their ingredients. It's the emulsifiers and surfactants, like what are they sweetening it with? Right. And then I want to know what flavorings are they using too? That's really important.
I think it's mint, but.
Yeah, I'd have to see it.
But our thought on glycerin.
Great question. So ours does not have glycerin in it.
Okay.
That being said, yeah. So Mark and I have dug deep into this because we like to be very evidence-based with our recommendations. That's functional medicine, right? So the whole glycerin controversy, what people talk about most is that it inhibits mineral uptake and it prevents remineralization. That's really never been shown in any literature or data. However, and I will tell you, I see patients using hydroxyapatite toothpaste with glycerin and they still get remineralization and benefit. That being said, I'm not confident what glycerin is doing to the oral microbiome. And there's not enough testing. And I just think I'm a very less is more person. And I think so many of these additives and things, I know why they're putting it in there. It took us 2 years to develop this toothpaste. Because it was really hard to take things out. It was really, really hard and keep it stable and allow it to not separate. I mean, think of natural peanut butter. So there's the oil on top, right? Versus Jiffy, which is all emulsified. Well, we know which one's better for us. So it's the same with toothpaste. Like it wants to separate. And that's what some of these additives and glycerins and things are like. It's holding everything together, but at what cost? What cost to the microbes in your mouth? So we are glycerin free. So okay. I don't think it's necessary. I will openly accept any research that shows me it truly inhibiting complete remineralization. I mean, maybe it slows it down a little bit, but I still do see some products that have glycerin working, but I just don't think it's necessary.
So just quickly recapping, going back to fluoride, just for all the people listening to this, you don't need fluoride in your toothpaste and you don't need fluoride at the dentist. That's the bottom line.
Well, your water, that's the big thing.
Or your water, but I'm talking about a dental visit specifically.
That's my perspective. Now, if you're extremely high risk for cavities, and you don't have access to hydroxyapatite, or you can't afford it because it's a little expensive because it's new right now.
So
right?
you need hydroxyapatite if you're not using fluoride?
I think you need a remineralizer would be my suggestion.
Which I don't know if people even know what that means.
Yeah, so it has to be something that's putting minerals back into your teeth. Now, this depends on your diet and your mineral contents. I will just say most of us are vitamin D deficient and mineral deficient, and we're eating a modern diet. So if you are strict paleo and you're only eating meat and vegetables, I'm not so worried about what you're using. I don't even really care if you brush and floss, but who's eating that way? I'm not necessarily advocating for that, although that is how I try to eat. But if you're eating breads or pastas or cereals or even
the standard
rice,
American diet,
the standard American diet, but even that can be clean. You can say, well, I eat clean. I eat organic rice and we have organic cheddar bunnies but it's still flour and it's still fermentable carbohydrates. And if you're eating those things, chances are you are out of balance. You're losing minerals from your teeth. You're feeding your bad bacteria, and you should have a remineralizer.
Okay. That's really helpful. And,
super interesting.
I'm excited to try your new toothpaste at the time we're recording this. It's not even out yet, but we know it when everyone's listening to it, it will be. So
and what's it called?
Yeah, it's called, great question. It's called FYGG, FYGG. And the reason is it stands for Feed Your Good Guys, because we're talking about nourishing the good bacteria. We're really trying to educate patients that not all bacteria are bad. We need bacteria. There's beneficial, we are mostly bacteria. We need to support and nourish our bacteria and not wipe them out and think 99.9% germs killed. And, we know that whole germ theory thing has been causing a lot of problems. So it's called FYGG. And we have flavors for kids and adults.
Awesome. Because like you said, you got to get those kids early thinking about their teeth more than just, what they use to chew their food.
Mm-hmm. And it has the remineralizer in it, correct?
Hydroxyapatite, yes.
Okay.
Yep.
So I know we need to kind of start wrapping this up because I do feel like we could have you back on to dive more into this. Are there any tests specifically that you would encourage parents to consider if their kids are getting repeated cavities and having some dental issues, but their dentist isn't really helping out? I know there's this new oral microbiome test. Or is there anything that they could get done outside of their dentist if they can't find a functional or holistic dentist in their area?
For sure. I think the most important thing I would do first is to know their vitamin D level. Just because I've seen such a connection in my office with the case studies I've done. So I would look into that, especially if you're having any other blood draw for whatever reason, but they have finger prick tests now too. But I just have found so many kids are so deficient and no one's testing them. Their pediatricians aren't testing them. So I would start with vitamin D. You can microbiome test in kids. The problem with kids, their microbiomes are very transient because think about how much they're putting things in their mouth. So every time we put something in our mouth, an object, our hands, even food, we're shifting the microbiome. And so it can be helpful, but if your child has cavities, they're pretty certain to have strep mutans. But what's interesting about the microbiome testing is then we can discover, do they have candida? Do they have fungus, which is also linked to cavities? So the brand I like is called Bristle, like the toothbrush Bristle. And that's a direct to consumer, just a spit test. So your child has to be old enough to spit, which is usually 3.5 or 4. And it's real easy. You send it off and then you get this really cool report. Their interface, their website's wonderful. And then if you want, you can work with a functional hygienist, kind of almost like a health coach, who will help you target the specific bacteria in your mouth and might say, hey, you need more nitrate rich foods. You're low in nitrate producing bacteria, which is nitric oxide. So you should eat more beets, or here's a supplement I recommend to really up these beneficial bacteria. And that can help your cardiovascular health. Or with kids, your child has candida. We should do a candida protocol. working with your naturopath, your functional medicine doctor. So those can be really helpful. If your child's really struggling, sometimes doing like an organic acid test or like a micronutrient test could help too. But, these things add up and get tricky with kids. So I like to start real simple, but also gut test, like a stool test. I mean, if your child has eczema, or if I see mottled hypoplastic teeth, like if they come in mineral deficient, a lot of times I am thinking celiac, I'm thinking gluten intolerance, or at least intestinal permeability. Like maybe they're not absorbing their nutrients and minerals properly. And so what's going on in their gut? Do they have parasites? Do they have food intolerances or sensitivities or allergies that aren't being diagnosed? So we work a lot with the gut too.
That's so fascinating. And Marnie and I run a lot of those tests that you mentioned for our clients as well as integrative health practitioners. So, yeah.
I know we need to wrap up here, but just a quick question. I'm wondering what you think of the teeth whitening products.
Yeah.
Just the quick answer.
Yeah, I'd say most of them are pretty damaging.
To your teeth or to your body?
Both. Both to the teeth and to the microbiome. Yeah, I mean, you just want to be careful. So hydrogen peroxide, it's really reactive, and it's carpet bombing too. So you're trashing your microbiome. So I see a lot of these TikTok videos going viral. It's like, rinse with straight hydrogen peroxide multiple times a day, and these people have shiny, blazing white teeth. But I'm just thinking, oh man. And it can be damaging to your nerve, your pulpal chamber, and your nerve in your tooth too. So,
is that why some people get tingly when they say that they're tingly? Yes. My husband, when he's done it, he's like, oh, my teeth are tingling.
Yeah, some people, they really hurt after. So you just want to be cautious. I mean, a lot of people use charcoal toothpaste. Be careful with that. That's extremely abrasive. It can be damaging your delicate enamel. So a lot of these things I say, just use cautiously. Maybe don't do them every day or every week, just a couple times a month. But really trying to avoid things that stain but I will tell you, nanohydroxyapatite, that remineralizer I spoke about, the calcium phosphorus, nanohydroxyapatite has white papers now showing that it actually whitens teeth. And it's because these little particles, they incorporate into the enamel if it's wavy or bumpy or has kind of mineral loss. And so this is about light reflecting and refracting. So if it fills it in, it creates a nice smooth surface. And then so the way the light hits, it will boing, your teeth will look brighter and whiter too. Coconut oil pulling can help. We are working on a product for patients too. I don't know when that will happen, but
we'll get it out there soon.
It's requiring so much research, to be honest with you. I wish there was an easier answer, but you can go in and get the whitening done at your dentist's office. I'd just be very limited with it. I wouldn't be overdoing it. But the other thing is,
I've done it like probably once every 5 to 8 years.
Oh yeah, that's fine. Some people go in monthly for this stuff though. I mean,
oh really?
Oh boy, I've never done
that. I haven't either. But the other thing too, we have to think too. I mean, what's the root cause here? It's not necessarily that our teeth are dark. It's that we're seeing photoshopped images of Hollywood celebrities with thousands of dollars of veneers. And so now we're like, oh, my teeth should be that white? No, they shouldn't. That's not real. That's not a natural tooth color. Now, I know that's a bigger issue, and we want bright white teeth, but just knowing that bright white, it's not natural. And there's going to be risks, much like Botox, like we talked about earlier. There's risks to some of these things to keep us forever youthful looking.
You got to pick your poison, right?
Yeah, exactly.
Yep. Or not.
But I would say, well, for sure. I mean, you also have to do what makes you happy and feel good about yourself. So,
Right.
But I would say if you get done with some of this whitening and your teeth are really sensitive, that's your body saying, that you don't want to end up with all these root canals down the road because you killed your nerves from this, chemical reaction that was happening.
I think that's great advice.
Yes. And so much for our listeners to think about and so many tips that you shared. Okay. So Staci, where can people learn about you, you mentioned the name of your new toothpaste, but like your website, and I know you have a lot of resources. You have a free guide.
Yes. I have a free product guide because people ask me a lot, well, what's the best toothbrush? What supplements should I take for my kids? So I just created a guide for you. It's free. It's 300 products. I've tried them all. I can vet for them all. I update it. I try to update it quarterly. That's on my website, drstaci.com, and doctor spelled out, and it's STACI. I'm on Instagram a lot with free education and support, and that's doctor spelled out _Staci. I'm on YouTube and TikTok a little bit too. I do take new patients. We have patients travel all over the country and actually other countries to see us if that's available to you. I'm in North Portland, Oregon, and that's called NoPo Kids Dentistry, NoPo. And it's NoPo because it's North Portland. It's just the area of town that we're in. And then my toothpaste is fig.com, FIGG.com. And then you can go and check out our products there. And maybe by the time this does come out, we might have some whitening options. I don't know. Doubtful, but I'll work on it. I'll hustle hard.
Well, that's amazing. And we'll link all that up in the show notes. So thank you for that.
Yeah, thanks.
And as we wrap up this conversation, one thing we like to ask all of our guests is, what does the art of living well mean to you?
Yeah, it always changes for me, I think, because there's so many things to be appreciative of. But for me, it's really community like this. So thank you so much for having me. It's connecting, realizing we're more alike than not. And I think that's what a lot of us are missing, is this sense of purpose and community. And gratitude for all the wonderful things we do have. It's real easy to get focused on the things we don't, or what we're doing wrong, or the minutia of this product or that product, like we were just talking about. But it really is just about human connection and love, to be honest with you. So that is something that's really important to me, and that's how I like to run my practice with my patients too. It's all about emotional health in my practice, beyond the tooth.
Well, that's beautiful. And I think more people should emulate some of what you just said in their practice, like just as a dentist, to be focused on the emotional help and the connection, because you're right. It's missing, and it's much needed.
Dentistry is scary. I mean,
well, I think kind of like cold and sterile a little bit. Like traditional.
And claustrophobic.
Yeah.
Oh man, it's if you can go on my Instagram story right now, you have to watch this comedic reel these women did about what it's like to go to the dentist. I was dying. You have to go check it out today.
I will.
And
okay.
We'll link it. We'll link it in the show notes. I'm dying about it. And I think it's really important as dentists. We forget what we do becomes so normal to us, but it's not normal for our patients. Right. And it's very uncomfortable and intimidating and scary. And so we need to remember that. And so just to lead with love.
My youngest daughter, who's 17, I mean, she hates going to the dentist. Her whole life she has, and she has beautiful teeth and no issues. And it's just like every time she's like, oh,
I know.
And she just dreads it.
My whole goal with my practice is to change that. I really try to make sure every kid comes so excited and they leave like, yeah, the dentist is so awesome. I mean, that's always my goal, more than the tooth. It's not the baby tooth. It's their experience that is going to really influence and shape their health. And so your daughter needs to come see me.
I know.
Fly her out here.
We may need to plan a trip to Portland, which I've never been. It's actually on my bucket list.
Oh, I would love to hang out.
Yeah. I mean, Dr. Staci, you are truly transforming oral health with all you're doing and your education and sharing your knowledge and helping to educate more dentists out there. And I just love your energy and your passion. And so thank you so much for being with us today.
That means a lot. Thank you.
Yeah.
And have a great weekend.
Thank you. This was fun. I appreciate it.
Yeah. Bye. Bye-bye.